Hi, my name is Kelsey, and I'm going to point out some of the bones in the appendicular skeleton for you. So I'm going to start with talking about the pectoral girdle. The pectoral girdle consists of the clavicle, the scapula, the humerus, the radius and ulna, the metacarpals and the carpals, and the phalanges. And the way that the pectoral girdle connects with the axial skeleton is by a joint here called the sternoclavicular joint. Now I'm going to tell you about the pelvic girdle. The pelvic girdle consists of the coxal bones, the femur, the tibia, and the fibula, and the metatarsals and the tarsals and the phalanges. The way that the pelvic girdle connects with the axial skeleton is by a joint here called the sacroiliac joint. So I want to start with looking at the clavicle, and the clavicle bone has two ends. It has the sternal end, which is where it connects to the sternum, and then it also has the acromial end, which is where it attaches to the acromion. Now I want to look at the scapula. So the scapula's coracoid process is right here, this part right here, and there's the subscapular fossa, which is a little divot in the back here. And then there's the glenoid cavity where the humerus articulates with the scapula. And if we look at the back, the scapula has a spine, and then at the top of the spine is the acromion. Above the spine is a place called the supraspinous fossa, and underneath the spine is the infraspinous fossa. If we look here, this is the acromial clavicular joint, and it joins the acromion with the clavicle, and in the front there is sternoclavicular joint joining the sternum with the clavicle. So now I would like to look at the humerus. This is the humerus, and on this part right here, this bulb, this is the head of the humerus. On this side is the greater tubercle, and in the middle here is the lesser tubercle. If we look on this side, there's a little bump over here in the middle, and it's called the deltoid tuberosity. And if we look down here on the inside, this is the medial epicondyle, and on the outside here is the lateral epicondyle. And then here in the middle is the coronoid fossa. What goes in the coronoid fossa is the coronoid process of the ulna. If we look at the bottom of the lateral side of the lateral epicondyle is the capitulum, and this articulates with the radius bone. If we look at the bottom of the medial epicondyle over here, this is the trochlea, and it articulates with the ulna. So now, if we turn the skeleton around and we look at the back of the humerus, this is called the olecranon fossa, and what goes in here is the olecranon process of the ulna. So, if we look at the forearm of the skeleton, this is the ulna, and the olecranon is at the top of the ulna, and the radial tuberosity is the bump up here. There's also the styloid process, which is down here, and then we can start looking at the radius. The radius has at the top is called the head, like the humerus, and there's a bump right here, which is called the radial tuberosity, and then down at the bottom, this is the styloid process. So now we can start looking at the carpal bones. We start from the thumb side or the lateral side, and we move in. The first bone is the scaphoid, and then the next is the lunate, and then there's the triquetral, and then there's the pisiform. And if we look at the distal row of the carpals, from the lateral to the medial, the first bone is the trapezium, and then there's the trapezoid, and then there's the capitate, and then the hamate. The bones that form the wrist joint with the radius and ulna is the proximal row of the carpals. The proximal row of the carpals form the wrist joint with the radius and ulna. So the bone that forms a joint with the pollex would be the trapezium from the distal row of the carpals. So if we look at the hand, these bones here, the middle ones between the carpals and the fingers, are called the metacarpals, and then the fingers, so the last two sets of bones, are called the phalanges. So now if we look at the pelvic girdle, the coxal bones are comprised of the ilium, which is the top, and the ischium, which is down here, and then the pelvic bone, which is right here. So when during development, the skeleton's coxal bones are separated. About here would be the ilium, and then down here, right here, would be the ischium, and the pelvic bone would be right here. So if we look at the pelvic bone, if we see that acetabulum, that's the spot where the femur bone articulates with the pelvic bone. The pubic symphysis is the joint here between the two. The orbitor foramen is the hole that you can see here. And the iliac crest is this top ridge here. And the anterior superior iliac crest is the front tip here. The iliac fossa would be the bone right here. If we look at the greater sciatic notch, it's this divot right here. And then the ischial spine is the bump right below it. And then if we check at the ischial tuberosity is this ridge right here. So now we're going to look at the femur. So the femur is this large bone here, and the head of the femur is the bulb right here. The greater trochanter is on this side, and the lesser trochanter is right here. The adductor tubercle is down here on the inside, and the medial epicondyle is right here too. And the lateral epicondyle is out here on the other side. The medial and the lateral condyles are on the back, and they are right here, the two bones there. And then the patella is the kneecap there. So then if we look at the tibia, which is the larger of the lower leg bones, the medial and the lateral condyles are at the top, up here, the medial and the lateral. And then the tibial tuberosity is the bump up here on the front. The medial malleolus is right down here, and the proximal and the distal tibiofibular joints are the proximal one is up here connecting the tibia and the fibula, and the bottom one is down here connecting them. Then if we look at the fibula, the top of the fibula is the head, and the bottom is the lateral malleolus. We can look at the tarsus bones. The talus is this one back here, and it articulates with the tibia and the fibula. And then on the outside over here is the calcaneus, and then in front of that is the cuboid. And then in the front of the talus over here, this is the navicular. And then we have the medial cuneiform and the intermediate cuneiform, and then the lateral cuneiform. And then we have the metatarsals, which are right here, and then in front of that are the phalanges, and then the big toe is actually called the hallux.